Hi, welcome one and all. Today I am going to present a small session on World Hepatitis Day. Every year, July 28th is observed as World Hepatitis Day. What is the relevance of this day? This day is especially dedicated for hepatitis to give a mass awareness about the disease. The red and the yellow ribbon symbolizes hepatitis. The significance of red indicate the blood and the yellow represents bile, the secretion of liver. This year's theme is Finding the Missing Million. Approximately 325 million people around the world are affected by hepatitis. And strangely, majority are unaware of the fact that they are having hepatitis disease. Let us watch a short film on hepatitis.
There are currently 325 million people worldwide living with a deadly disease in their blood. Are you one of them? 325 million. That's the equivalent of the entire population of the United States of America. What's worse is that 290 million of them are completely unaware of their infection. An infection which could destroy their liver and lead to life-threatening illness. Are you one of them? 9 in 10 people are totally unaware they are living with viral hepatitis. And since viral hepatitis has very few recognizable signs or symptoms, how would you know that you are one of the missing millions? You could have got it at childbirth, passed from your mother. You may have got it through unsafe injecting practices or by sharing a razor, or coming into contact with infected blood. It's likely that you won't know when you got it. If you don't get tested, you'll remain in the dark. Viral hepatitis is one of the leading causes of death worldwide, claiming 4,000 lives a day. But if you don't know your status, what chance do you have? However, this doesn't need to be your future. There is a cure available for hepatitis C, and vaccines and effective treatments against hepatitis B. So why not eliminate viral hepatitis for good? We need to find the missing millions. If we can find the people unaware of their status, we can save lives, and we can eliminate viral hepatitis from the planet by 2030.
That was a movie from the World Hepatitis Alliance, an organization known for its role in advocating and awareness raising for the elimination of viral hepatitis. What is hepatitis? Hepatitis is the inflammation of the tissue of the liver. The most common cause of this disease is by viral infection. However, the viral disease can also occur secondary to heavy alcohol intake, certain medications, toxins, and other infectious diseases. Autoimmune disease and non-alcoholic hepatitis, that is called as steatohepatitis. Steatohepatitis means it is the liver inflammation and damage that is caused by accumulation of fat in the liver. There are different types of hepatitis. The viral hepatitis is classified into 5 different types because each of them express different symptoms and require different treatment strategies. And they are viral hepatitis type A, type B, type C, type D, and type E. In this, type A and E are caused by contaminated food and water, which can be treated by proper medication in right time, and it can be easily reversible. Whereas B, C, and D can lead to chronic hepatitis viral infections which may end up with liver inflammation, liver enlargement, liver cirrhosis, and can lead to hepatocellular carcinoma. Here I am going to display the different stages of liver infection. The first figure shows the normal healthy liver with proper texture. The second one is fatty liver. So what do you mean by fatty liver? The fatty liver means the more accumulation of fat. As a result, the liver will get inflamed and will be bulged. It can lead to fibrotic nature of liver, that is called as liver cirrhosis. And in acute case or in chronic case, it can lead to liver cancer. Now we'll move on to the causes of hepatitis. The main cause of hepatitis is hepatitis virus. Apart from that, there can be other infections which also can lead to hepatitis infection. Heavy intake of alcohol and toxins as a side effect of certain medications, autoimmune diseases, non-alcoholic steatohepatitis due to accumulation of fatty liver may end up with hepatitis. Now we will discuss more about hepatitis B. Hepatitis B is a serious liver infection caused by hepatitis B virus, which is a DNA virus. This virus can cause both acute and chronic infection. The disease is said to be acute if it lasts less than 6 months, and if proper medications are taken, it can be easily recovered and easily reversible. The other type is chronic infection. In this case, the disease will last more than 6 months. Having chronic hepatitis can become very serious, as it may lead to the development of liver failure, liver cancer, or even liver cirrhosis. Now let us know how the transmission of hepatitis takes place. The first and foremost transmission of hepatitis B is through sexual contact with infected person. Having unprotected sex with someone infected with virus can pass through blood, saliva, semen, and even vaginal secretions. Through these secretions, the virus can enter into our body. The second type of transmission is called as parenteral transmission. HBV virus can easily spread through infected needles and syringes. It also can pass through by sharing the equipments which are used in body piercing, such as ear piercing and nose piercing, and even when we are using the razors and sharing with infected persons. Sometimes it can also happen if we share the toothbrush, and while brushing the teeth, through that bruises the virus can spread when we are sharing the toothbrush with the infected persons. The next category is mainly through blood transfusion. Without proper checking, if we are receiving the blood from unknown person, it can spread or it can transmit through the blood to another person. The last mode of transmission is perinatal transmission. From infected pregnant mother to the developing fetus, it can transmit, and the baby is born with hepatitis B infection. Now we'll look into the signs of or symptoms of hepatitis. The persons which affect the hepatitis, if it is acute, means the signs and the symptoms will be very mild. And at this stage, many of the persons will be unaware of the fact that they are having the hepatitis. So there will be a chance of neglecting the signs and symptoms in the initial stages. But when we look into the more detail, the main symptoms of hepatitis are fatigue. Fatigue means tiredness, sudden nausea and vomiting, sometimes the abdominal pain or discomfort, especially on the upper right side beneath your lower ribs. That is the position of liver. In later stages, we can see the clay-colored bowel movements and dark urine, loss of appetite, low-grade mild fever, joint pain, and even it shows encephalopathy. How can we diagnose the hepatitis infection? Mainly we rely on laboratory serological test. The serological test means the evaluation of hepatitis B generally consists of liver enzyme tests in blood. They include the levels of alanine aminotransferase, aspartame aminotransferase, alkaline phosphatase, that is called as ALP, alanine aminotransferase ALT, aspartate aminotransferase AST. Along with this, gamma glutamine transpeptidase as well as liver function tests that include serum bilirubin and serum albumin level. With this, we can also test international normalized ratio. In all these cases, ALT, AST, ALP and GGT, even serum bilirubin and INR will be elevated in hepatitic cases, whereas serum albumin will be lowered. Low level of serum albumin shows the liver is not functioning properly. That is why the albumin is lowered within the body. With this, the latest techniques we are following are antigen antibody test in the blood. The main type of antigen we are looking for is hepatitis B surface antigen, commonly we'll call it as HBs antigen. The antibodies we are looking into that is anti-HBC. HBC stands for hepatitis B core protein and immunoglobulin M. HBsAg is positive in acute chronic infection. However, the presence of immunoglobulin M and anti-HBC is diagnostic of acute infection. We can also rely on imaging techniques. The most common imaging technique we follow is abdominal ultrasonogram and even scanning techniques such as fibroscan also used. The main treatments for hepatitis are as follows. The first and foremost preventive technique we adopt nowadays is definitely vaccination. Vaccination is used as a preventive technique. The protection from vaccine lasts for about 20 years and it is said to be lifelong. Hence, it is highly recommended, especially among healthcare workers who are at the highest risk of contracting the disease. If the hepatitis is coming under the category of acute hepatitis, the antiviral medicines are prescribed, and along with that home therapy also is instructed. During that time, the patient should completely take rest, and they have to get proper sleep. They have to take more amount of fluids such as water, and also they have to avoid intake of alcohol. If the patient is taking any drugs which can cause more stress to the liver, such drugs have to be avoided during that period. And if all these conditions, if the patient is following, means complete recovery is possible. But in acute cases, that is chronic liver damage, the latest medicines which coming under the category of interferon, that is mainly alpha interferon treatment is followed. And in severe case of chronic hepatitis, it may result in liver damage. In such cases, we can go for even liver transplantation. Now at present, we are facing with pandemic infectious outbreak, that is COVID. So we should know whether is there any relationship with COVID and hepatitis infection. The impact of COVID-19 on liver function in patients with chronic hepatitis B remain unclear. Some studies report that COVID-19 may result in liver injury. About half of patients presented mild elevated serum levels, that is ALT and AST levels. That is an indication of liver damage. The abnormalities of liver function are common on COVID-19 patients with chronic hepatitis B, which even can worse and can lead to death of the patient. I hope that this session is informative. Stay safe and healthy. Thank you.